Hey everyone! Welcome back to the channel. Join me as we explore the complex world of healthcare policies and see if I can unpack insights from Jonathan Haidt and Dr. Robert Malone. Jonathan Haidt is a well-known social psychologist and author who has written extensively on the intersection of politics, morality, and social behavior. Dr. Robert Malone, on the other hand, is a physician and researcher with a strong background in healthcare policy and medical ethics. Both of these experts bring unique perspectives to the table, and their discussion on healthcare policy is sure to offer valuable insights. The current state of healthcare policy is a pressing concern for both providers and patients. One of the major challenges is ensuring accessibility to quality care. Many people struggle to get the medical attention they need, and this can have serious consequences for their health. The rising costs of healthcare are also a significant burden for individuals and families. Furthermore, there are concerns about the uneven distribution of healthcare resources, with some areas having more access to specialized care than others. Another challenge is the complicated and often fragmented nature of the healthcare system. Patients often have to navigate multiple providers and systems to get the care they need, which can be confusing and frustrating. Additionally, there are concerns about the quality of care being provided, with some patients experiencing preventable medical errors or receiving inadequate treatment. The COVID-19 pandemic has also highlighted the need for more effective healthcare policies, particularly when it comes to responding to public health crises. The policy debates surrounding healthcare are multifaceted and contentious. Some argue that the government should play a more significant role in providing healthcare, while others believe that private providers and market forces should drive the system. Jonathan Haidt and Dr. Robert Malone offer their perspectives on these debates, drawing on their expertise in social psychology and healthcare policy. They discuss the pros and cons of different policy approaches and offer insights into how to improve the healthcare system. One pivotal moment in the discussion comes when Haidt and Malone emphasize the necessity for a more nuanced approach to healthcare policy. They argue that policymakers must consider the complex interplay between individual freedoms, social solidarity, and economic realities. By taking a more holistic view of the healthcare system, they suggest that policymakers can develop more effective solutions that balance competing interests and priorities. This approach requires a deep understanding of human behavior, social norms, and economic incentives. In their discussion, Haidt and Malone also emphasize the importance of empathy and understanding in healthcare policy. They argue that policymakers must be able to see things from the perspective of patients, providers, and other stakeholders. By doing so, they can develop policies that are more responsive to the needs of all parties involved. This requires a willingness to listen, to learn, and to adapt to changing circumstances. The key points discussed by Haidt and Malone emphasize the importance of understanding policy impacts on healthcare. They highlight the need for more effective and compassionate policies that prioritize patient-centered care. Their insights offer a valuable perspective on how to improve the healthcare system, and their discussion provides a nuanced understanding of the complex challenges involved. If you can relate to any of the issues on healthcare policy, I'd love to hear them. Leave a comment below and let's keep the conversation going. If you're interested in more discussions on healthcare, be sure to check out our other videos on the topic. Stay tuned.